Thank you for virtually joining us as we review the latest situation regarding COVID-19. I'm very happy to be joined by Dr. Catherine O'Reilly and Hany Bakr, and together we'll share our predictions of what travel will look like post-COVID-19. But before we explore that new environment, I would like to ask Dr. Kate to take us through the notable changes in the pandemic over the last week.
Thanks, James. Hi, everyone. So as of today, the 18th of May, globally, we have seen over 4.7 million cases and over 300,000 deaths. The United States has reported the most number of cases with over 1.4 million, and they're followed by Russia, the United Kingdom, and Brazil, and then a number of countries in Europe. Case numbers in Africa are now over 81,000, and Lesotho was the most recent African nation to report its first case. In the last week, we've also seen a number of countries ease their lockdown measures, as a number of countries also experience anti-lockdown protests, which can be an indication of secondary security impacts that can occur as a result of the COVID pandemic. So as countries start to get back into a more normal working pattern, there is a little bit of nervousness about whether we will then see a spike in cases. We have classified a number of countries as waning, so they are now kind of reporting less than 100 cases a day and declining case numbers. And so far, Norway, Greece, Australia, New Zealand, South Korea all fit into this category. There's a lot of interest in how these countries will now cope as restrictions are lifted. We've also seen the approval of an antibody test by Roche. It's been approved in the USA and the UK and a number of other countries. And this is a finger prick test that detects whether someone has had the COVID virus. WHO still says that we shouldn't be putting too much importance on immunity. We still don't know how long someone is immune for once they have had the virus. So with any disease, after exposure, you get immunity. But how long that immunity lasts is unknown with COVID. With a disease like measles, it's for life. And with other diseases, it's for different lengths of time. So still worth watching the space on that. Thanks, James.
Fantastic. Thank you, Dr. Kate. So now, if we take a step to the future and discuss how travel will be impacted as we start to see movement restrictions and movement initiating in certain locations, there are many variables challenging organizations on when to allow travel, should it be necessary, and alternatively, we're seeing organizations start to strictly evaluate the role that travel plays in their business operations. So to this point, one of the first questions that we would like to discuss is, what do we see as some of the key triggers to signify the engagement of travel again? And I'll throw it to Dr. Kate very shortly, but from a security perspective, there are a number, but some of the primary triggers that could signify that engagement of travel again could include the fact that domestic travel will likely be first to restart. And if that is successful, that could potentially then lead to the opening of international travel as well. So domestic travel will very much be that litmus test of efficacy of measures by the governments to be able to manage the approach to that. And then should that be successful, moving on to opening of international travel. Likewise, though, dependent on local government directives, there may well be local isolation, quarantine measures put in place for non-nationals, and the impact that potentially could have on business operations and the efficacy of traveling into a location will also need to be considered by organizations around the world as well. Another component that Kate touched on regarding the anti-lockdown process is also those secondary security impacts as well. It may well be that there are underlying socio-economic conditions that are exacerbated by the COVID-19 crisis, and where we may see related unrest, anti-government protests, anti-lockdown protests. Those may also have an impact on organizations' ability to operate safely and effectively in those environments as well. So monitoring of those and understanding of those and the potential challenges created by those is key. And then it could also be looking at the internal debate on the role that travel plays within organizations. It may well be that there is a new perspective on managing operations in a remote environment that will need to be considered when looking at the engagement of travel and looking at those components. And Dr. Kate, perhaps on the medical side, maybe there are some additional triggers as well to consider.
Yeah, thanks, James. I think lots of the medical triggers perhaps apply both to domestic and international travel, and social distancing is one that's going to be with us for a long time. So we've already seen as domestic travel starts to kind of come back in a lot of countries where the easing of restrictions is happening, blanked off, so people can't sit next to each other, queuing systems where there is, spot marks on the ground to stop people getting too close in queues, and triggers so that if say a railway station is too full or a train has too many passengers, then they will close off that station or stop allowing people onto a specific train in order to stop overcrowding and allow social distancing to be in place. We've also seen a lot of countries, some have encouraging the use of masks or facial coverings, and others are making it mandatory for use on public transport. So we will see that, I think, for a while to come, and also hygiene measures, hand sanitizers in stations, the ability to wash your hands, in public places. We've also seen a number of airlines who've already started to implement passenger screening. This tends to involve temperature checks and questionnaires to passengers, and that's happening at gates before people board aircrafts. So there's a number of medical triggers that are being implemented, and I think that the social distancing will stay around for a while.
Fantastic. Thank you, Dr. Kate. And I suppose following on from what you just said there, the other question, or the second question we'd like to discuss is, what other health interventions could we see in the new travel environment as well? So, Dr. Kate, are there any other additional health interventions that we could be seeing in this new normal?
We've also seen that in a number of countries, on arrival, passengers are still being quarantined when they arrive from another country. That's a 14-day quarantine, but they are being offered testing. So they undergo a COVID test at the airport, and they get that result within a few hours. If they're positive for the test, then they do not have to undergo quarantine and can continue with their business or whatever they need to do. If they are negative, then they have to fulfill the 14-day quarantine, whether it be in a hotel or where, the place that they've stated they will stay for those 14 days.
Fantastic. Thank you very much. The final question that I'd like to raise, and to bring Hany into this as well, is, Hany, what do you see as the future of travel, both domestic and international?
Well, thank you, James and Kate, for the insight. So first of all, the aviation industry recovery will be impacted by numerous factors. So such as countries' GDP, there is certainly a positive correlation between GDP and aviation demand. Secondly, oil prices. So the COVID-19 has caused a sharp decline in demand for oil, leading to a large drop in the price. Now, oil prices make up around 25% of airfares. Additionally, air travel disruption. So things relating to the current global travel restrictions, and certainly consumers' confidence that I want to cover as well. So once this is restored, we will see more and more people returning to air travel. Now, where possible and economically viable, the traveling public may elect to use more direct flights instead of transit points, just to reduce their risk exposure. In terms of future travel, James, we would see an overall change in the travel experience, which would likely commence at the flight booking stage, with air carriers requiring passengers, for example, to provide more information than what they used to. So this includes medical, residency for contact tracing, travel history, and so on. So now, how will this data be handled is the question. How will it be processed, transmitted, and eventually destroyed? I think this will open a healthy debate about data privacy and protection, probably not too dissimilar to what we've witnessed back during 9/11. In terms of airports and aircraft experience, this will equally vary and change significantly over the next few months. So the whole experience will evolve around the no face-to-face contact, physical distancing between staff and passengers, that check-in, immigration, security, retail, airport facilities, and certainly boarding gates, unless it's absolutely necessary. So this will likely motivate changes in airport design, more investment in technology and introduction of more contactless solutions. Other examples include the rollout of the likes of plexiglass screens at check-in counters and boarding gates, and again, immigration shops, restrooms, and everywhere around the airports. Reduction of hand luggage to be carried by passengers is expected to be introduced by airports and air carriers to avoid passengers having to take them off at the security checkpoints, and certainly to speed up the process of screening. Measures introduced to ensure physical distancing at airport security lanes whilst queuing anywhere around the airports. Airport retails would go cashless wherever possible. Non-food and pharmaceutical retail are likely to remain closed for some time to come. Now, in terms of airports, we'll likely have designated isolation areas for passengers or staff that develop symptoms whilst at the airport. And if required by arrival or departure countries, a number of health check measures then would be introduced. As for aircraft or flight experience, removing of paper in-flight magazines, no food service or beverage, to be instead having some items on your seat prior to boarding, and making on-board announcement about what to expect at the arrival station. Other physical distancing measures to be in place that on board an aircraft and while boarding, by the crew managing, keeping adjacent seats empty and middle seats empty, and the crew managing the mobility within the cabin, the crew managing traffic into the restrooms to ensure that physical distancing. Quarantine areas on board an aircraft will have been established and written through policies, aircraft and airlines policies for passengers that develop symptoms whilst on board. And certainly the quarantine requirement, James, the 14 days quarantine period, will see those being imposed and removed by a number of countries. But from an aviation community perspective, we see this as causing an inadvertent major impact on travel demand, which would hinder the aviation recovery plans. However, we see this as an accelerated, as means to accelerate the digital innovation agenda for aviation industry.
Thank you very much, Hany, for that. So it's clear, and my thanks to Hany and to Dr. Kate as well for their insights, but it is clear that with the ongoing travel restrictions and the evolving changes to the pandemic, it's important for organizations to proactively evaluate their travel policies and procedures to ensure that it supports this new environment as well. So thank you very much for joining for today's virtual update. To learn more about how we can support your organization in a safe resumption of travel, please do get in touch. As the situation continues to evolve, please do continue to review our up-to-date information, advice, or assistance regarding COVID-19.